Unfortunately, after over 2 weeks of the escalation of the crisis, the humanitarian situation is quite catastrophic. Today, we have more than 2,200 casualties, with over 900 people who passed away. More than 1 million of the population have been displaced, 630 sheltered in public schools, and 80% of the population is in private homes. Unfortunately, Lebanon did not receive 10% of the humanitarian needs. There is a huge gap in the support that is being provided, and that's quite very alarming. We are also seeing an invasion happening from the south. 150 villages have been emptied, and these internally displaced population, we don't know if they're going to come back. These people sheltered at their relatives or in private homes or in the public schools, in the collective shelters, unfortunately lack basic needs. They lack access to food, to hygiene kits, diapers, assistive devices, access to health and special care for the vulnerable people, being older people, children, person with disability, or female. The situation is quite catastrophic, and unfortunately, until today, we are seeing people in tents, living in tents in downtown and some border areas under the storms and the rain, which is quite very alarming, and humanitarian perspective is really very bad, especially that Lebanon has been facing 7 years of protracted crisis, where already the humanitarian actors and the people are quite depleted to face another challenge. So we call the international arena to really support Lebanon. One, to preserve its borders and its land, to make sure that Lebanon keeps on the territory that they have, but also to address the humanitarian crisis that is quite extremely alarming, and whereby AMEL Association is doing its best to ensure support. We were ready from day one to mobilize our mobile units to cover the maximum number of people displaced, but also to support with food, non-food items, distribution of mattresses, blankets, winterization items, hygiene kits. The Prime Minister announced that Lebanon has up to 2 months of food security in the market, and the Ministry of Public Health said that there are medication for 3 to 4 months, and afterwards, unfortunately, due to the ongoing regional crisis, the air is closed, and most of the warehouses are located in Dubai, which makes it a challenge for Lebanon to access additional funds. So measures need to be taken to ensure that people live with dignity and humanity.